to the Wednesday, March 30th, Washington State Department of Health Media Briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Tao Sheng Quanget, Chief Science Officer, LACY FEHRENBACH, Deputy Secretary for Prevention and Health, and Michelle Roberts, Assistant Secretary for Prevention and Health. To begin today's briefing, we'll open with remarks from Secretary of Health, Umair Shah.
Thanks, Nikki. Thanks for kicking us off. And good morning, everybody. I wanted to just start by welcoming, again, our media partners, and just want to thank all of you for continuing to be with us. I did want to make a programming note right off the bat that starting in April, we will be changing the cadence of these meetings and the frequency of these meetings, and so there'll be more information from our comms team. But we will be moving away from this either weekly or every other week schedule that we were on. So just more to come. Wanted to at least let you know right up front. Today we have my colleagues here. We're here to discuss several critical topics that are important for people across Washington. And the first thing and for most important thing is the fact that overall continuing to see positive trends in our state, which remains very hopeful news and continuing good news for all of us. And just want to thank all Washingtonians for everything that they have continued to do to be able to fight this pandemic, and certainly to be safe and protected, and also the same of those around them. The important information we're going to be sharing today includes, as you know, the announcement around the additional booster shot that you heard, and also BA2, the status of that in our state. And then we're also going to discuss a little bit about Washington's supply of antibody treatment for COVID-19 as well. So we'll turn it over in order to our colleagues, my colleagues, to be able to answer and describe those separate topics. So let me start by just saying, again, in Washington, the trajectory of cases continues to be on the decline. And that, again, is fantastic news and welcome news. And we want to continue to see that news. And it's not just cases in the community, but we are continuing to see hospitalizations also decreasing as well. And LACY will be showing some of these curves for you in just a moment. But just again, this is another promising sign of the pace of where we are in the pandemic, and also the declines that we're seeing, which is also important for all of us to recognize. That said, we're also watching BA2 across the country and across the globe. And it is true now that BA2 has now become the dominant strain for COVID-19 positive cases in the state of Washington. We are, however, the data are not showing that it is impacting hospitalizations as of yet. And while overall the cases and hospitalizations continue to decrease, the proportionality of BA2 of the cases has increased. And so I think that's an important message. So again, overall, things are better. The case numbers, hospitalization numbers are better. BA2 is now the dominant strain in Washington, and we are certainly watching that very closely because we are recognizing, obviously, how it's playing out in other parts of the country and the globe. Hospitalizations are similar to the low point in summer of 2021, and cases are nearly as low. So again, this is wonderful progress, and we are very happy to see this. Things are absolutely better, but we continue to monitor the situation as we had committed to in the Walk Forward plan that we had put out just a couple of weeks ago. Now, this is an interim period, right? So this is what we have seen many times, and hopefully we will see a different place here from where we've been previously. Previously, we would see declines, and then we would see a surge. We're hopeful that we do not see a surge, and that we continue to see declines, and that COVID-19 fades into the horizon. But this is also a time to at least remember that we need to have those tools available and make sure that we and our families and those around us are prepared. And so we will ask folks at this time to continue to remember to use masks when it's appropriate, to keep your masks around. Don't just throw them away or say, I'm never going to use these. Also, we're asking folks to make sure that they have test kits on hand as well. And then certainly the main message that we have said throughout is staying up to date on your vaccinations and your boosters. And that is really critical. And let me talk just for a moment about the masking piece. And, this is just really more about how many are viewing masking right now. It is true that with low numbers and low potential for exposure or lower potential for exposure, that we do have a situation where many folks are saying, I don't need to wear a mask ever. And what we are continuing to remind people that it's an additional layer of safety, especially when you're in crowded, confined spaces or places with poor airflow or filtration inside. This would be perhaps a small crowded building or facility, an older building. If you're going to visit someone in your family or even somebody that's not in your family who is immunocompromised or at risk for severe illness from COVID-19, consider testing and wearing a mask before you visit. And then certainly we know that we have spring break coming up and holiday travels. And if that takes you to community where COVID-19 levels are higher, especially if you're doing, for example, international travel, we really want you to also think through about wearing a mask, especially indoors, and also making sure that you're updated on your vaccines. Again, the reminder, the masks are still required in certain places like public transportation, healthcare, and correctional settings. And it's also a reminder that if you've been exposed to COVID-19 or have confirmed COVID-19, we absolutely want you to wear a mask anytime you're around others for the full 10 days. So again, hopeful news, positive news, but just a reminder to people when they should be wearing masks or when they should be considering wearing masks as an additional layer of safety. And then just having those test kits around and certainly staying up to date on vaccinations and boosters. So again, as WAV Forward and we put out there is that it's really important for us to continue to go forth with our activities and move forward with all the different things that we want to do, especially as we're getting into the spring to summer months, but we want to make sure that we're also thinking about safety and health in the process. So with that, I am going to turn it over back to Nikki and let Nikki go through our different speakers.
Thank you, Secretary Shaw. Next, we'll go to Deputy Secretary LACY FEHRENBACH.
Good morning. Thank you, Nikki. Thank you to our media partners for being here today. I'm going to give a quick update on what we're seeing in our data and surveillance activities. As of March 23rd, the subvariant BA2 accounts for 51% of sequenced specimens in Washington state. And nationally, the CDC is reporting that BA2 is about 55% of sequenced specimens. While BA2 appears to be slightly more transmissible than BA1, we do not believe it is more severe from a clinical standpoint. And we are also looking at not just the percent of cases that are a particular variant or subvariant, but also how that fits into our broader disease trends. Both hospitalizations and new cases in Washington state are continuing downward. And those declines have slowed down, but they are very low. They're similar to our summer 2021 lows. And deaths, daily deaths in Washington state are again, finally in the single digits. Currently, only 6% of hospital beds are occupied by COVID-19 patients. So these trends together, as Dr. Shaw mentioned, are reason to be cautious, in terms of that presence of BA2, and also reasons to be hopeful because disease is low in our state. Vaccines continue to provide strong protection against COVID-19, and that includes current variants of concern circulating here in Washington State, the US, and the globe. People who are up to date with COVID-19 vaccines are at far less risk for severe illness, including hospitalization, as well as death from COVID-19. And now is a great time to get vaccinated or boosted if you have not already done so. There is good supply of vaccine in the state, ready availability of appointments. So take that step if you have not done so. Talk to your healthcare provider if you have any questions. We are continuing to monitor the situation closely with regards to our data and trends, and that includes here in Washington State, across the nation and globally. We know that there have been or are BA2 waves in Europe and parts of Asia, and there are a few states in the US that are seeing signs of increase, but we're not yet seeing an increase driven by BA2 here in Washington State. I also want to take a moment to remind you that this readiness is part of our forward plan for Washington State, which also includes goals and commitments around engagement and empowerment, prevention, and then system readiness support and capacity. So on the engagement side, we have been successful as a state because we have all come together for the common goal of protecting health. That is doing some of the things that Dr. Shah mentioned, like getting vaccinated or boosted, wearing a mask, especially if you are in a crowded indoor space or traveling to a place where disease is higher or vaccine rates are low. And then also working together to focus on healing, building resilience, connection, and community cohesion as we stay safer while COVID remains with us. We are going to be very focused on data monitoring and disease detection, using all of the tools we have to stay current and know the direction and condition of the pandemic here in our state. And certainly, when things change, we may adjust our response. These are things that we're doing. Of course, you all have actions you can do. Get vaccinated, get boosted to protect yourself against severe disease. Wear masks, have tests on hand. If you need any tests, you can order them from sayyescovidhometest.org and sign up for WA Notify. WA Notify is a free tool on your smartphone or iPhone that will alert you if you may have been exposed and allow you to alert others if you test positive for COVID-19 that they may have been exposed. Because viruses mutate when they are transmitted, one of the best ways we can combat future variants and keep our community safer is to limit transmission, and vaccines, masks, tests, and staying home when we're sick can help us to keep disease levels down and reduce our risk for future variants or a possible BA2 wave. So with that, thank you, and back to you, Nikki.
Thank you, Deputy Secretary FEHRENBACH. Next, we'll go to Chief Science Officer Tao Sheng Kwangget.
Thanks, Nikki, and good morning, everybody. Thank you for joining us. As LACY and Dr. Shah mentioned, things are moving in the right direction, and that's fantastic. But because there are still hospitalizations and deaths from COVID-19 occurring each day, and because we're continuing to keep an eye out for the possibility of an increase in cases from new variants, we want to make sure that those people who have moderate or severe immunocompromise, who are at higher risk of hospitalization and death from COVID-19, know about a preventive monoclonal antibody treatment called Evusheld that can provide 6 months of protection against COVID-19. It's an injection that has to be given in a doctor's office or healthcare facility. And it can be given to adults and children 12 years and older, and it needs to be given before COVID-19 infection. And it's potentially life-saving for two groups of people. So two groups of people are eligible for Evusheld. The first group are people who have compromised immune systems from either illness or medications that prevent their bodies from developing a protective response after vaccination. The second group are people who can't get COVID-19 vaccine because they have a severe allergy to the vaccine. So Evusheld is a treatment that could really be a life-saving game changer for these two groups of people. When it first came out in December 2021, it was very difficult to get because of limited supply. But fortunately, supply has improved greatly. And we now have thousands of doses of Evusheld that are sitting on the shelves going unused. And so we want to make sure that everyone who is eligible for Evusheld and could benefit from it knows that it's available. So if you are one of those people with moderate to severe immune compromise or can't receive COVID-19 vaccine because of severe allergy to the vaccine, be sure to talk to your doctor and ask if you are eligible for Evusheld. And if you are, work with your doctor's office to find a facility where you can receive the injection to get 6 months of added protection. In addition to Evusheld, which is given before COVID-19 infection, we also want to make sure that people who are at high risk of severe disease from COVID-19 know to contact their doctor right away when they first develop symptoms of possible COVID-19 or test positive for COVID-19 so that they can talk about possible treatment with medication. Because if you have a chronic condition such as cancer, chronic heart disease, chronic lung disease, diabetes, certain neurologic conditions, among a whole host of other chronic conditions, there are antiviral treatments and a monoclonal antibody treatment that can significantly lower your risk for hospitalization and death. However, they're only available by prescription, and they have to be given in the first few days of symptoms to have an effect. So if you are at high risk for severe disease and you develop COVID-19, contact your healthcare provider right away so that you can discuss whether these treatments could help keep you out of the hospital. Or if you're currently well and you're seeing your healthcare provider for another reason, such as a checkup or a wellness visit, you might have a conversation with your doctor about whether these treatments are an option for you if you were to get COVID-19 in the future. And if you were to get sick, how to get tested and treated if that were to happen. So hopefully that won't be necessary because everything's moving in the right direction, as has been mentioned. But it's always good to be prepared just in case we do start seeing an uptick in case rates. So thank you, and back to you, Nikki.
Thank you, Dr. Quanget. Next, we will go to, I'm sorry about that, Assistant Secretary Michele Roberts. Go ahead, Michele.
Good morning, everybody. I'm Michele Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. I'm going to share and start with some quick overview of the state's vaccination efforts, but then also share again and kind of highlight some of the same messages you've heard from everybody else about the power and importance of vaccines. But let's start out with some of today's data. So we've given out more than 13.2 million doses of COVID-19 vaccine to more than 5.8 million people across Washington. So this means that 81% of people age 5 and older, so those who were eligible for vaccine, have received at least one dose of vaccine, and nearly 74% are fully vaccinated. Every day, more and more people are protecting themselves by getting a booster shot. Across the state, we've given out nearly 2.7 million doses of 2.7 million booster doses of vaccine. So, and speaking of booster doses, there's some good news from our federal partners this week. For some, an additional dose of booster dose is now available. Yesterday, FDA and CDC authorized a second booster dose of the Pfizer and Moderna mRNA COVID-19 vaccines for those age 50 and older, and for certain people age 12 and older who are immunocompromised. This morning, we received formal guidance from the Western State Scientific Safety Review Work Group in support of the FDA and CDC's recommendations. So this means those who are eligible for a second booster can receive that additional dose. It needs to be 4 months or more since they got their first booster dose. Data continue to show that the COVID-19 vaccines offer powerful and substantial protection against severe illness, hospitalization, and death. And booster doses extend that protection. Booster doses are especially important for those at highest risk of severe COVID-19, including people age 65 and older, and people with underlying medical conditions that suppress their immune system. We can't emphasize enough that staying up to date on COVID-19 vaccines can save your life. Everyone age 12 and older is eligible to get a booster dose 5 months after completing, excuse me, hold on one sec. Sorry about that. I have a scratchy throat. Everyone 12 and older is eligible to get a booster dose. Sorry, I'm going to come back after
You
questions.
want to take a moment? Yeah, Michelle, why don't you take a moment? We'll come back, and I hope you feel a little bit better there. Nikki, we'll turn it to you, and we'll start Q&A, and then when Michelle's ready, we can let her finish.
Thank you, Michelle, and thank you, Dr. Shaw. We'll come back to Michelle for the final part of her remarks. This will bring us to the Q&A segment of today's briefing. First up, we have Nicole with Cairo Radio. Nicole, just one moment. Nicole, go ahead.
Good morning, everyone. With BA2 on the rise, obviously, and some counties are seeing a rise in cases and hospitalizations. King and Snohomish County, for instance, I believe in King, it's gone up 26% in the last week. Does this appear to be linked to the lack of masks now in the last couple of weeks, or is it linked to BA2, or is it a mix of both? And is it possible that we could see some restrictions coming back, and if so, which restrictions would those be?
Thanks, Nicole, for the question. And, I think the first thing we have to remember is that we are seeing the proportionality increase of what percentage that we are seeing BA2 characterized within the number of cases. But overall, across the state, the total number of cases as well as the hospitalizations, that those are decreasing. So I think it's important to remember that while we may be seeing some increases in certain communities versus others, overall in the state, we're seeing the total number of cases are coming down. That said, we are obviously monitoring what's happening. And I think when you ask the question about the masking, I believe what you perhaps were getting at is that people not wearing masks as much, if I understood the way you were framing
Yes.
that. Is that correct? Okay.
Yeah, that's correct.
Yeah. So, from that standpoint, it is something that we continue to, to remind everybody that there are certain settings where we do believe that masks are important. Now, again, the statewide requirement for masks, as you know, has gone away, but there are certain settings where I know all the people that are on our team right now on this media briefing that we have our mask with us and we use, but then there are other settings we do not use. And so I think it's important for us to just be thinking about that as community members of when's the right time for us to utilize. And then certainly we also recognize that there may be other considerations that are as part of how we're looking at what kinds of activities that we engage in or when we engage in those activities. So I think that's the key message for us, is that we are watching BA2, and obviously we are seeing in some places some increases, and they're still small. And if they're small in a community, remember the big thing that we're looking at is how is that driving the transmission across the state. The other comment or question that you asked was about whether restrictions or anything else would come back. At this point, we're continuing to monitor what's happening. And obviously, if we had a situation where we had a significant surge across the state, then we would have to look at what are additional tools that we would need to be, perhaps even policies need to be looked at. But at this point, we are continuing to just remind people the importance of all the different messages and the actions that we have laid out there. So, LACY, I think you were wanting to add something as well, and then we can turn it over to Michelle.
Yeah, no, it's really to the first part of Nicole's question. When we look at other parts of the US and the globe where they are seeing waves, it likely is a combination of factors in change in policies, which also people, signals to people things are getting more back to normal. So there's more, not just less masking, but more activity happening, combined with waning immunity. So it really is important to think about the measures you can take in the midst of BA2, which we did mention is more transmissible. And that includes, being up to date. So being boosted if you're not boosted, getting vaccinated if you're not vaccinated, even if you had COVID, and even if you had COVID fairly recently, taking those steps and then, having your masks around and using them in more risky environments, certainly all of those things will help us keep disease rates low. If we experience a wave, keep the wave relatively low. The other that we haven't mentioned and should is maximizing ventilation. So doing as much as you can outdoors, or if you're indoors, having windows open or your filtration and airflow high.
Nicole, would you like to ask a follow-up?
I think that's it for me. Thanks.
Okay, thank you. At this time, I would like to return to Michelle for her final comments.
Well, thanks everyone for your patience and coming back. Seasonal allergies, and I can make a plug for the importance of having at-home COVID tests. So when you have symptoms that may be similar to COVID, you can take one, which I have done throughout this allergy season to just double check that I know what's going on and I don't have COVID and I'm not at risk of spreading it to my family or friends. As far as getting back to booster doses, just really, again, to emphasize the incredible importance of staying up to date on COVID-19 vaccines. So either initiating or getting your initial booster doses if you haven't done that yet, or for those groups who are now eligible for a second booster dose if it's been 4 months since their last booster dose. I want to thank everybody who's staying up to date on their vaccines. And like others have said, now is the time for everybody who's eligible to get boosted and hasn't yet, make that appointment today. So right now, 58% of people age 12 and up who are eligible have gotten their booster dose of vaccine. 64% of eligible people age 50 to 64 are boosted. And 75% of eligible people age 65 and older have received their first booster. It's important to note that these numbers are kind of statewide numbers, and there is significant variation among different groups by counties, by neighborhood, by race, ethnicity, by age. So this can increase your individual risk. So you can learn more about what may be happening in your county or within your age group on our data dashboard at doh.wa.gov. And before closing, I want to give a quick update on vaccines for kids age 6 months to 4 years of through age 4. Right now, we still don't have a final timeline on that. FDA is awaiting additional information regarding the ongoing evaluation of those vaccination in that age group. Pfizer says they expect to have more data on 3 vaccine doses in that age group in the coming weeks. Moderna has said they'll apply for FDA authorization for its vaccine, and we'll keep you updated on any new developments. So in closing, getting vaccinated and staying up to date on your vaccines continues to be the best way to protect yourself and those around you from COVID-19, especially against severe illness. To find vaccine locations near you, visit the state's vaccine locator website or vaccines.gov. If you need help or have questions, call the state's COVID-19 vaccine hotline at 833-VAX-HELP. Thank you.
Thank you, Deputy Secretary. We will return to our Q&A portion of the briefing. And next up, we have Kate with KUOW. Kate, one moment. Okay, Kate, go ahead. You should be able to talk.
Hi, all. Thank you so much for doing this today. I appreciate it. Just wanted to see, in the midst of all of the information that people are getting about BA2, surges elsewhere, booster shots, everything that's coming out, what is the main thing that you want the public to know at this point in time? If there was sort of one takeaway message for folks, what would that be? And then also, can you talk a little bit about what is going to happen for folks who are uninsured when it comes to getting vaccinations and testing, since there's some issues with federal funding for that? Thank you so much.
Yeah, thanks, Kate. I'll turn the second question over to LACY. On that first question, if Dr. Kwanget and I can answer this one, my main message is that the pandemic is not over. We are at a different phase of this pandemic, but the pandemic is not over. That you can still get infected with COVID-19, and COVID-19, especially in certain groups or especially by risk, can still be dangerous. And the message is that we have all the tools now. We know what those tools are. We know how to use those tools. We've given all the guidance. We've made those tools available. We've done everything we can to promote how best to use and when best to use those tools. And so this is a time where, yes, we want people to enjoy their activities and go out, and especially as to LACY's point about being outdoors and the weather is starting to turn. We want to make sure that people are doing those things, but we just want to make sure that they're keeping safety and health in mind. And so I think that's the main message, that think about this as another phase of the pandemic, and things are absolutely better. We want to continue to see that, but don't let off the guard completely and say, we're done, we're out of this, we're moving forward, because that's when people may get into trouble. So that's my main message. And Tal, you may have some additional thoughts about that as well.
Yeah, I agree, Dr. Shah. Things are moving in the right direction, and we're optimistic, but we have to always be planning for the uncertainties and the unknowns. And I think especially for people who are at increased risk for severe disease from COVID-19, those with chronic conditions and immune compromising conditions or immune compromising medications, it's really important for all of us to help protect them, and that's by getting vaccinated, and that's by wearing masks in appropriate situations, as well as thinking about other preventive measures such as Evusheld that I had mentioned, as well as thinking about talking with their physician about how to prepare if there were to be an uptick in cases, if they qualify for treatment, and how to get tested and treated quickly. Thanks.
Kate, would you like to ask a follow-up?
I think if we could just get to that second one from LACY. Yeah, thank you so much.
Yes. So the first thing we'll want to start with is, if you are uninsured, like number one, consider looking on the exchange, the health benefit exchange in Washington State, to see if you can get insured. If you remain uninsured, there still are some options available. So many of the mobile clinics and vaccine clinics that local public health and the state run are actually funded through FEMA reimbursement, and people who are underinsured and get their services at those sites would not have to pay. Insurance is not billed. There also is a program through the state's healthcare authority that provides grants to places like federally qualified health centers, rural health clinics, public hospital districts, even behavioral health providers, to help cover the care costs for uninsured individuals. And that could include testing and treatment. So we, first of all, want to really thank our partners in the Healthcare Authority. This program existed before, but they have really amplified the availability of these funds and stepped in with this loss of HRSA funding to cover important services related to the pandemic for uninsured people. So those are some of the options. Number one, get coverage if you can. That's important, for your broader health, physical and mental, and access to care. And then if for some reason you can't, and you need care before you can, some of those places I mentioned, like your community pop-up sites, local public health, community health centers, public hospitals, et cetera, likely have access to that funding and could potentially cover costs for uninsured individuals.
Thanks, LACY. Kate, one other message that, and this goes to both what LACY and Dr. Kwanget as well as Michelle have brought in, and Michelle can certainly add to this, but I just want to make sure with the announcement this week around the additional booster dose that we're particularly interested in the populations who are at most risk for severe disease and seniors. These are the populations that we really want to emphasize, making sure if you've not gotten your first vaccine, even get vaccinated. If you're eligible for your booster, especially with the change and the additional recommendation from this week, get your booster. This is the population that we're really, really concerned about. And we've said that multiple times, but I just want to make sure it's those who are at increased risk, and especially those seniors. We want to really get the information out to get your vaccination status or your booster status updated. That is so critical to our messaging to everyone, but in particular to these populations. And then certainly when you're around somebody that's of that either a health condition and or age, that's what you want to also be careful with the actions that you're taking as an individual. So just wanted to add that. And Michelle, anything you wanted to add to that? Because I think that's a key message that we do not want to overlook is what occurred this week.
Yeah, just add that staying up to date with your COVID vaccines it can save your life. Like, it is incredibly important. Like Dr. Shah said, we are still in a pandemic. I mean, there's lots of hopeful signs, but we're learning in real time about long-term protection of these vaccines, especially against severe illness. And it's the power of these vaccines to prevent severe illness is astounding. More than 20 times as likely to not die if you have been boosted compared to being unvaccinated. And that data continues to hold strong every time it's looked at. So I think we can't emphasize enough, while we're still in the midst of an active pandemic with a lot of not knowing what is next, the best thing you can do is stay up to date on your COVID-19 vaccines.
Thank you. Our final question comes from Sally with the South Seattle Emerald. Sally, just one moment. And go ahead.
Thank you very much. I just want to follow a little on what maybe what Kate asked. And I want to make sure I understand the statistic, because it seems as if our counting of cases is less accurate today because of at-home testing than it was maybe 2 months ago. Can someone comment on whether you think our statewide numbers remain accurate?
Thanks, Sally. This is something we've talked about many times previously, is the fact that as we get our tests, and especially the goal to get tests into the hands of people, the individual, the Washingtonian, the consumer, it is true that we are going to see less and less being reported to public health agencies, and that's what the state health department relies on when it comes to that and laboratory testing when we look at our numbers across the state. That's part of the reason that we have been so focused on not just one number, but a set of numbers. And then the other piece of the important number is the hospitalizations. And that severe disease, that hospitalization number, that is what also is helping us continue to look at what's happening across the state, monitoring what's happening across the state, and then certainly taking appropriate actions when warranted. So I think you're correct that we get less and less a look of what's happening, but there is no doubt that all the different numbers that we are seeing and all the different information that's coming in, the summation of that is that things are improving. So it's not, both can be true at the same time, I guess is where I was going, is that we do get a less of a look, but we're also relying on additional data pieces that help us make decisions and or monitor what's happening in the state. LACY, or Tao or Michelle, anything you wanted to add on that?
I think you covered it well on the data side. I'll say, it is a trade-off. And also we think that at-home tests are a really valuable public health tool. They're low cost, they're convenient. You have them in your home. You can use them frequently as long as you have supply. And that can be to test before you go visit someone who is immunocompromised or at risk for severe disease. It can be when you have seasonal allergies or other signs or symptoms of COVID-19. You don't have to leave your house, right away, and you're not going out and potentially exposing others to COVID. So, it does reduce our visibility, and we have lots of other signals that we're looking at, as Dr. Shah mentioned, and they're a tool that help us stop the spread.
We're glad that people are using home testing. And as LACY said, it's such an important tool. And if you test positive at home, you can report your case by phone so that your case can be included. I guess the other thing I'll mention is that our epidemiologists have been working hard at updating our surveillance system for COVID-19 so that we can account for home testing and still provide the important data that we need to follow the course of a future surge were it to happen. Thanks.
Thanks, Sally, for that question. I know we're at time, so I will just go back to Nikki, and as we close, just say thank you again. We are continuing to see positive and hopeful news. We are watching what's happening across the globe and across the country, and certainly monitoring everything that's happening within the state of Washington. And we want to remind everybody, just make sure that you have those tools available, access them, have them in your home, have them in your, in close by, so that you can use them at the appropriate time. And we continue to make sure that people are reminded of how important it is for vaccinations and boosters, and especially the populations that we are equally concerned about right now, which is those who are with a chronic health condition, immunocompromised, or seniors. So just want to say thank you again to our media partners. And again, we will, I believe that's the last question, if I'm correct. And if so, I'll turn it back to Nikki.
Thank you, Dr. Shah. This does conclude the question and answer segment of our briefing. This also concludes today's media availability. If any of our media partners have follow-up questions, they can address those to doh-pio@doh.wa.gov. I'd like to thank our panelists for their time today, and TVW for hosting today's live stream and archives of past briefings. Thank you, everyone, and take care.
Thank you.